Afternoon and welcome to another edition of the program Well Body Talk. We come to you from the Society for Radio Democracy 98.1 FM. Well Body Talk they come to you from 5 to 6 every Thursday. And inside Well Body Talk, we dey look at different system we mona motama well body and self we get expert them we can get at the studio where they talk on then issues here so and later you self with the listen can be part of the program Well Body Talk. We say you go call and ask the experts them as we can deal with different topics them inside the program Well Body Talk. Me where they bring you this edition of the program Well Body Talk, Musa Kamara Naminim. And I want to welcome my studio guest for today, now Dr. Amadou Alusain Joanna, in a registrar, Family Medicine Department, University of Salon Teaching Hospital Complex. The topic for today now understanding and managing gonorrhea in communities. So the topic today now gonorrhea. Hello and welcome.
Hello, moderator.
You don't be, of course, you don't be guest for Well Body Talk. Perhaps this could be the second or third time, but we listeners can vary at certain given time. For today audience, it will tell we Udana Dr. Amadou Alusen Juana in the medical field.
Yeah, thank you so much. I did do when I register na the Family Medicine Department. They do the junior residency program na University of Salon Teaching Hospital. And family medicine unit, we can see all cases. We can see picking them. We can see young people, elderly, then also ageable people. So now a whole approach we start from a child up to death. So we cut across for see all sector of people as a whole.
Okay, that's your rule. How person they be family medicine person or register the family medicine unit?
Yes, thank you so much. The very first you get passion for the see patients them. Then though you get different specialty in the family medicine unit, but in as much as that you need for go to an exam, you for sit the primaries where the West African College of Physicians can conduct every year, twice a year in March and also in October or February or in September as a whole. And as a result of that, when you take the primaries exam with you first degree where you get as a whole, you can apply for become a resident or for do the program. The course we go take like 5 years as a whole. You get 3 years as a junior resident to be a senior resident. Then from there you can take curatively 2 years. Then you become a consultant as a whole.
You make mention of residents, senior or junior. Who done a resident?
Resident na somebody we get a role for playing at the department of any of the sphere. It can be internal medicine, it can be family medicine, it can be surgery. Now somebody we don't sit the primaries, we don't pass, you automatically become a registrar. And when you be a registrar, you for be a resident for cover the activities we required. You get service delivery, you get academic sessions where required. You also get some research programs. So in as much as that, you therefore the top of the situation at the unit where you find yourself as a whole. So now a whole lot of a resident for go to several activities them. Each of the departments then get their whole them for play as a whole. Yeah.
But before you be a resident, whether it's junior or senior, if you don't get the degree from commerce, is that the case?
Yes.
So you can get from any university apart from commerce for be a junior or senior resident?
A medical university. You can study in town, Sierra Leone, you can study any of the West African country, then they can approve as long as you graduate and you get your first degree has been endorsed, You go through the program, 6 or 7 years program, depending the setup. Then you can come in, you make a program for go through rotation, because that will help. You do your rotation within 1-2 years, then automatically within the 4 regions, you do obstetrics, gynecology, you do pediatric, you do surgery, then you do internal medicine. And at the end of the day, with this 4 sphere, you can put in for city primary, who's how you get interest in. There's several people can get interest in surgery, now the choice. It's just like where you are eat, not to everybody, all man like in sauce. So it is also with you desire for do service delivery in the medical field. Yes.
Now, for instance, you just to do residency in a hospital, or you can do a many side.
Well, you for the under a university, or like do residency. If for the under a university, if for the under a department, then through that you go able to get a requirement that you go to specific activities. Because each program what you do, you expect for make they endorse you. There should be head of department where they approve, say, which you don't do, they endorse them. And you get activities then, both online, then also in the various departments then, as a whole. Yeah.
For you, now the residency, how you can describe them in terms of the learning process?
Well, very interesting, because the very first important thing, they put you toes on ground for make you know the importance. Say you the head for be a consultant. If you the head for be a consultant, you get big tax for play. You discipline required, your commitment required, your dedication. Then you even your ethics, because as you go alongside, you get for be scrutinized by several set of people.
So now that level you don't reach.
Well, we go through the level, not only one. You have senior registrar. After you sit exam, you get junior registrar, just like that. But before you become a consultant, you need to go through a process. There are a lot of disciplines involved. They just go no more for go get degree. But it's a collective aspect will involve your character, your conduct, equally, ethics as a whole. You'd expect when somebody come out for be a consultant and not just no book, but in behavior counts.
What are the difference between a registrar and somebody with a medical doctor where they treat people in a ward?
Well, the sector of the medical field gets a own, because we get grades them on the Ministry of Health. The medical aspect, when you immediately graduate, you can be a doctor. But when you be a doctor, you can classified. You need for do a housemanship. That is what you don't learn within the all 6 years as a whole. You required for make provision for get some basic fundamental skills them in each of the sphere. That's the housemanship you required for do. Then equally, immediately you done, you need for go to the medical dental council for make you become from a house officer to a medical officer. So you need for get a permanent license. And when you get a permanent license, you automatically become a medical officer. So you have house officer, you have medical officer. Then immediately after medical officer, you expect for the 1 or 2 years activities in the same medical field. Also, you get interested in the process of doing service delivery. Then you go choose which side you want to take exam. And when you take exam, then you come up from one stage, then you go to another. That is to say, you get house officer, medical officer. The third stage, you for be with registrar. So the gap between a medical officer and a registrar, you can be a senior medical officer. You only could be endorsed or approved after you take a primary exam. Because before entering for do a consultancy, you need to take a primary exam. Then automatically you can become a registrar. When you become a registrar, process also involved as a whole. Registrar now, that's somebody where they do ongoing course under a specific university, just as with the, you get for land day. People can be a registrar and no one land. Choose say, I can just be registered, I don't sit, I don't upgrade. But the registrar now hierarchy, like closer to the consultant. Then from consultant, you get professor. And so, yeah.
That's not just a basic knowledge on the medical field. Inimna Dr. Amadou Alosan Juana, Registrar Family Medicine Department, University of Saloon Teaching Hospital Complex. We topic for today na understanding and managing gonorrhea in communities. That's not our focus of discussion. We just made a key preamble and basic understanding of your role na the medical field. With regards to what we there for talk about today, the understanding and managing gonorrhea in communities. Let me start first. What's in a gonorrhea?
Yeah, thank you so much. I think gonorrhea get for deal with a bacteria way then called Neisseria gonorrhoeae, where they infect specific region of the body. It can start with the urogenital region. It can affect also the pharynx. It can affect the conjunctival as a whole. Then eventually it happen for be a sexually transmitted disease. Because being a sexually transmitted disease, the primary focus get for deal with the organ. And when it gets affected by the organ, then automatically the person gets for being infected. So now a disease way can be direct, you can acquire through genital contact, and it localize na the surfaces within the region of the organ, the urogenital organ as a whole.
The program now Well Body Talk, and today we look at gonorrhea. You don't give a definition of gonorrhea as a sexual transmitted disease. Yeah, what's in that like the method of someone contacting this one apart from sexual transmission, or sexual transmission at all means?
Well, you get several risk factors in which way person can get, where you get unprotected sex can be one. You expect you don't know that you meet, forget contact, intercourse with, then eventually you can get infected to unprotected sexual activity. One, it can also be where you get multiple sex partners. People are when they're out, you get 4, 5. You can involve in that. Thirdly, the homosexual set of people and really commit man-to-man relationship, then equally with somebody previously they don't get sexually transmitted disease. As you get them, then automatically they get. Then you get people away and drug user them as a whole. So eventually all these aspects can be where people can get gonorrhea. If you rule out, like for picking them now, neonates, then can also get exposed to them. Because
how picking will get gonorrhea if not sexually transmitted disease?
Well, the bacterial gets away, the pili, the pathogenesis of pili, the way they attach, because it's bacterial. When mommy they born begin, like a pregnant woman, if the pregnant woman gets infected and not treat himself well, because the pikin get for pass through the cervix, your expectation say any disease way the mommy get, it can be transmitted. And because it can be transmitted, nine can say, hey, the pikin born, the pikin yeah, get Apollo, and yeah, it gets conjunctivitis as a whole, So basically, it can be through that trend as a whole. All those risk factors are involved, because without such, waiting to happen, person not go able to happen for get the sick as a whole. Yes.
How somebody going to say don't get gonorrhea?
Yeah. Thank you so much. Well, you get several signs and symptoms where you look at. The very first thing you can factor, get for deal with the location outside the sick day, because we are dealing with two sex here. You get man them where then gets their own aspect where can involve the urethra. Side the way the wet for the pass, where man want wet, pass, use the restroom, you'd expect, say, if somebody get gonorrhea, they get urethritis for man. And as a result of that, in urethra, they swell. And when urethra swell, it'll be a challenge, can be one. For woman, them, the cervix, it can get inflammation of the cervix. So it can get like cervicitis. So when the cervix inflame, automatically don't get infected. So at that early stage, nothing no can show. Maybe you can get few signs and symptoms where you want wet. You notice say the person they feel for wet, but the wet they born. For man, then 90% of most men them when they get exposed, they can very symptomatic. At early stage, they can get serious where the fluid they change as it increase in volume and color they change. And when in color change, it become purulent, maybe yellow. Say, I don't begin wet now tough, you know. And in that presentation there, you obviously know say, oh, something don't go wrong. I don't get infected, number one. For women, them also similarly, the odor of the discharge, you can get vaginal discharge, you know, and eventually, as the color they change, they determine the grade at which the illness they as a whole. So basically, it can present such way. Where other presenting can they maybe abdominal pain, you know, the bottom belly.
For both man and woman.
Yes, obviously, man self can get some pelvic pain as a whole, you know, can get flank pain, all can associate with that, you know. And when that can occur, you they notice say several options. Immediately when people get time in community setting, you can say, hey, just go take flagyl, you know, or just go take Cipro. In fact, can I give you bezatin? In fact, can I give you ceftriaxone, you know, quick. We don't get plenty bush people, bush medical people away. As somebody sick, you don't take decision immediately. Just kill this. But you don't know the intensity of them. You don't know the grade. You don't know side it's in there. So primarily, you can get them as you get that early stage. You discover, say, oh, there is a need for like go see doctor because something don't go wrong. Because if you self look through, you didn't know say. If you self look through, you didn't know say. Number one, if you self look through, you didn't know say number one, there is a challenge where they deal with waiting. They present it, the way how the person they present as a whole, you know, some abdominal discomforts they get joint pain and all those things. Yes.
So apart from the inside and now they no more somebody will realize them. Apart from them, you get any sign again in the person because you make mention of the young baby within the bone.
Yes. For man them as well, other features than they where man then can get maybe one part of them private can swell, you know, and can get one part swell where the scrotum one side can swell, and when that swell get for deal with otitis, but all that as a result of how the bacteria they travel, you know. Then obviously for picking them also it can influence through the eyes. Then as the disease they travel, you for also know say as the disease they infect all the other part of the body, you can get also things for deal with your joint as a whole, you know. So basically it can also you can also get another set where they deal with the brain because you get gonococcal meningitis, all that categorized under waiting gonorrhea as a whole. Yes.
Let me look at gonorrhea properly. Is it a risk factor for HIV or any STI
Yes.
or STDs?
Yes. They all tend for intertwine because if in fall under STI, then if it's not properly treated, they attract obviously HIV, they attract other viral infections them as a whole, or viral diseases as a whole. So not only they all fall on the same class, because if you get gonorrhea, you're vulnerable for total other diseases, for either being man or woman as a whole. So obviously risk factors and because when you contact with somebody on protected sex, you don't know the person whether a carrier of any disease, whether the person get hepatitis, whether the person get HIV, whether the person gets syphilis. In any stage the person fell say, you don't know. And because you don't know, they all fall under the same category. And if they fall under the same category, there is high need for waiting, for do some preventive measures. So it's a risk factors. Yes, gonorrhea is a risk factor for HIV, for syphilis.
Gonorrhea they kill?
Well, depend on the grade. We not get such disease way present that we say this is not gonorrhea killer. Okay. But the point now is, if you get superimposed infection, superimposed disease, we relate to that. Person can get gonorrhea, but it been superimposed by HIV, or it can be superimposed by hepatitis. So you expect, say, not to actually the gonorrhea go kill, but the other underlying causes can influence that as well.
Apart from the urinary tract, where you make mention, say it affects both man and woman, is gonorrhea in any way they wound the private parts, like boil and other things? Can do them?
Yes.
Or just the tract?
No, not only the tract. Externally, because the thing get for deal with pus, and because the thing associates with rash, because the thing associates with itching, you find out for CC the discomfort of the individual, not to the gonorrhea self they cause the rash, but the discomfort of the individual, being male or female, can also influence for let the person create harm himself indirectly. Because the discomfort with the person they get, you always expect there is a need, there is a way out for making self become comfortable. Then all of a sudden, it can tend for harm himself. So patients, where they come in, some patients then they obviously can get that. They not only say they get gonorrhea, but they can also get some sores, because these are all the list of things. They can get sores them as a whole. And for women, them other issues can they. They can get like painful intercourse. Can get issue for relate with post. And can get post bleeding, post uterine bleeding. Like person go there for seeing period as a woman, then automatically they take a longer process. They bleed, the bleeding never stop. Then they bleed for a shorter period. Then after that, it bleed back. So in other words, instead of it, they bleed within a month session, every 2 to 28 days, you find out for say it can get unusual, dysfunctional uterine bleeding. So that self can influence as a whole. But most of the sores can trigger by the individual, not like the gonorrhea they give the sore. But the itching, the rash can also provoke that or precipitate that.
Most times you can already say, a person don't get infection at public toilet. Is it gonorrhea now one of them?
Well, urinary tract infection no can actually associate. But if you take example now, somebody they use restroom, we already get gonorrhea, right? Because they go use the restroom, then another individual self go use the restroom. Your expectation now say, obviously, because the place, the hygiene of the place, the status of the place not healthy, you'd expect say the bacteria they host there, then all of a sudden, what's in the happen? The individual they become carrier. As they go sit down, as they go use the restroom, himself get infected as a whole. But the primary cause has to deal with through intercourse, because you get both vertical and you also get indirect. You get sexual contact, through sexual contact, then you also get vertical transmission. So the vertical transmission therefore be upward. So if somebody gets a disease, you expect, say, if the person go use the restroom, then you are sitting there upward, vertically, you say for expect for waiting, forget the transmission to that. So we can always advise crowded places, people more than they in one green restroom for 15, 20 people, care needs to be taken, Yeah.
The program now, Well Body Talk, it comes to you from 98.1 FM, and we studio guest today Dr. Amadou Alusen Juana, Registrar Family Medicine Department, University of Saloon Teaching Hospital Complex. We topic now understanding and managing gonorrhea in communities. We go for short break inside the program Well Body Talk. We come back, we go engage with studio guests and self-open phone line for make yourself call and make a contribution inside the program Well Body Talk. Remember, say me they bring you this edition of the program. Musa Kamara na my name, and Well Body Talk they come to you every Thursday from 5 to 6, and we can get experts them in the studio. They talk on the specific sick them we can more people them, and yourself can get opportunity for call and ask questions to the experts who can get at the studio. We'll go for a short break. We'll come. We continue the program Well Body Talk.
It's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
This is J-Bank's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah. No condition is permanent. You never know if someday you will find yourself in that same situation in this life. You've seen today, tomorrow is the promise. In a twinkle of an eye, your story might change. Be you black or white, no matter your personality. Be you rich or poor, your story might change. 'Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Cause no condition.
The condition is permanent. Yeah.
Shout out to you, white priest. YUK man of the moment. I salute you.
Program now Well Body Talk. They come to you from the Society for Radio Democracy, 98.1 FM. Studio guest today Dr. Amadou Alusen Juana, Registrar Family Medicine Department, University of Saloon Teaching Hospital Complex. Today we look at gonorrhea and the management in our communities. We look at understanding and managing gonorrhea in our communities. We don't get basic understandings about gonorrhea. Before we come to management in communities, look at if somebody don't notice, say, he get gonorrhea, waiting for being first step.
Yeah, thank you so much. I think the individual need for first and foremost see how best they forget medical attention because you no go think say you get a particular illness, then you choose for do in your way. So the very first thing where you required, you for make sure say you draw attention for say let you seek medical advice, at early stage. You no go choose say because you get this illness, as you tell a neighbor, a nurse or a pharmacist go take decision for decide say now for take this medicine you go better as a whole. So the very first thing from your own community level, there is a requirement say immediately when you need keep well, you are unwell, preferable for go to the nearest hospital, then go check you for no waiting and waiting it for be done as a whole. Yes, sir.
Okay. What are some of the treatments them for gonorrhea?
Well, prior to the treatment, you can look at how you go do some diagnostic measures, because immediately when somebody get things say, hey, I don't get something strange. The way I dey wet, it not be the same. The color of me wet don't change. I dey wet past mark. Now I get pus. I dey notice discharge. I dey notice some purulent, some color. Me discharge offensive. The color don't change. The volume of me wet, the discharge don't change as a whole. So within the first thing, you go to the nearest hospital, or you go to the tertiary or secondary hospital, then go request for do some tests them for you. And one of the tests where they do, then for make provision for do culture. They take bacterial culture, where they culture the urine, then swab, then take swab site of the infected area, then they make provision. The first wet morning term can be first catch, just like where woman gets belly, you'd expect for do pregnancy test. In first urine morning term, you can say, hey, and for past urine, you check for no. So similarly, there should be a first catch of urine in the morning hour, we go able help for let you discover for say, oh, this is what I do. I notice say I don't get so and so illness. And if I don't get gonorrhea, my best approach now management. And one of the things where you think of management, they look at holistic approach. The management not can be on over here. You require say when you dey manage somebody, it involve care, it involve prevention, it involve cure. Because na a curable disease, you they only look at one side, say, hey, when you go to any person for treatment, the person na cure in effect for cure, but they rule out how it will tell you for prevent them. So one of the edge way hospital or medical people can get now for both cure and also make preventive measures, because then go get advice. Person go hospital, you want left, then go say, hey, yeah, look packet of condom. So per adventure you want use, make sure say you protect yourself. You understand? So the capturing about management required not to only for go take medicine, you return back home. For go take injection, you return back home. But you get for look at measures where go prevent you, not for have the same issue. One can be your hygiene aspect. You get for live healthily. In marriage life, they expect say you dey get intercourse in an unhealthy state or an unhealthy manner, as a whole. Then equally, you get measures then way for able help you for do preventions, because one of the measures where you expect for take the restroom you use go also count. Then you limit you multiple sex partners, and eventually you do that, you get some edge over waiting they disturb you. So automatically the first primary thing you roll out, you required for do some necessary tests we go able help. Number one, beside the test, you also get a result we go know the grade at which the illness day. Then automatically you do on specific medication. We get several medications that we required for be given or for be taken. Whether you give half-life where they deal with injectable, or you give oral medication as a whole, or you do even prevention like sit bath. You get bath pan for woman, them female. You use this thing, salt, lukewarm water, you do sit bath for a week, or you take anything related to antifungal medication where you're able to put for prevent, so that such measures can be taken place. So several medications, then we're not going to go direct on air on talking on medication. We can always advise, say, when somebody not well, the best measures make it go hospital, and list of things then they will need for be done. Yeah.
We take a look at how communities therefore manage the issue of gonorrhea, and we open the phone line on 077 981 981. Call and ask any question about the issue of gonorrhea as we get the experts. Now the studio 77 981 981. Now the number we go call and make your contribution and ask any question and comment on the program Well Body Talk. And as we still wait for calls, them inside the program on 077 981 981. I come to my studio guest again. What's expected of communities in terms of managing gonorrhea?
Well, we can go in a three-way approach. Health talk required for the education aspect. The very first thing, in a community setting, you get several units of career. You get youths them begin and need for get health education about sex at a specific age. They need for make provision so that risk factors not go disturb them. We get for deal with unprotected sex, for rule out how best available condoms or things then go there available for a particular community. One, then for reduce the sex partners. You get several other people. Some community they you get one person get how many relationship. And not only forget relationship, if you get contact, you not go to be infected, they go infect other person. You go home, pikin way no get exposed to anything because the pikin happen for go use the same restroom way parents they use, then automatically such things the person self gets infected as a whole. So both hygiene required on a community setting.
Okay, we'll get a caller on the line.
Okay.
You never said a call from Well Body Talk.
Yeah, good afternoon.
Yes, good afternoon.
Yeah, leader can concern caller. I want to ask doctor the person the wet fast. The wet fast. Don't get it. As you want go wet, the wet nearly come out the way they life for come on. So taking constantly. Please make me some make me some advice.
Okay. Plenty thank you. I think the doctor don't take note of that. Say if you go wet, you wet fast, and most times you can go wet. The strain for wet, the wet need to come as expected. They say make you explain if that day in any way get for with gonorrhea. 77981 Now the number for call and make your contribution inside the program 077-981-981. You can call on this number and make a contribution inside the program Well Body Talk, where they come to you from the Society for Radio Democracy 98.1 FM. You've been the talk before that call come inside. You can respond to that and respond to the caller in your concern. The program Well Body Talk, they continue.
Yeah, thank you so much. I think from the caller, they make mention of frequent urination.
We get another caller on the line. Your contribution.
My own question is that there are certain time people can talk, say, watching they get gonorrhea at school dog, say when dog wet, because you can see some dog then we get that in the private area. And say when somebody mass out in their foot, they contact her. And there are times that say the soul, also the way somebody don't work out at the soul for long time, and say it can cause gonorrhea. So I want my doctor explain inside the day if not school or not just traditional way of thinking. And that's not your question, sir.
Plenty thank you for your contribution inside the program. Doctor, I think you can take note of the things then concerns or then comment with all kinds.
Yeah. So as I be they say, let's conclude with how community go able manage.
Yeah.
The primary thing for deal with the hygiene. They expect community day, then get so much crowded place, then they use one restroom. Picking and can get stool indoors, then pass urine in the morning hours. So if the hygiene aspect can be organized well, you get septic restroom them, tank or pit them where people can use. But the hygiene aspect, it need for be thoroughly clean, then always modernize in a state or a manner that it's kind of healthy. One. Equally, you think about, as we say, the sex partners. We get for make provision for make people in specific community. If they no need for infect, they not make for infect others. They not for go get numerous sex partners. If you tend for do that, then obviously you're the big carrier. You know, go to sick, then you count and at the same side. So if you make provision for get unprotected sex, you for avoid that, for make sure so you protect yourself. Two, you for also make provision for reduce, because if you get multiple sex partners, then if you get history of previous sexually transmitted disease, you make sure so you treat yourself well. Because if you don't treat yourself well, any restroom you tend for use, you're vulnerable for infect other people, especially when people and go they sit down like that as a whole. Then people they take drugs, you know, they take any drugs with IV, they inject them, you know. Then set of people and self can get exposed. So these are all the risk factors where can provoke, where they affect the community level if management required for the as a whole. Yeah.
You get some questions then we come inside for you.
Yeah.
One be ask if somebody the wet, you need the wet it wet fast, but we can go wet, the wet need to come as expected within the cause that, and same way somebody say according to your understanding they say dog the cause gonorrhea waking wet with porcine massa. You can respond to them comments them and concern them.
Thank you so much. I think for the frequent urination, again for deal with age. As age they go, you get how urethra as for man, you'd expect say the power of urethra for function. So it not necessarily means if you wet fast, that means to say you don't get gonorrhea. No. You can wet fast, you expose say you get sugar sick. You know, you can wet fast, you expose say you get any urinary tract infection. Though gonorrhea itself can be that as an influence, you know, where frequent urination can be. But the primary thing for deal with the age matters. Somebody who don't carry age so much, you know, they expect 60 or 70-year-old pa, not for the wet small. Because how in urethra they, it don't exhaust them. Picking way small, the same thing applicable. But at a middle-aged individual, as a young person, it's not really usual for you expect for the wet fast. Because if you eventually the wet fast, then automatically there is infection.
As young boys then growing up, we can get this pissing competition. Would then piss they go up passing company? Is it that gets anything to do with the urinary tract, the power at that moment?
I think that get for deal with the ascending or descending of the kidney based on the age. You know, as I likely say, the early age of picking them between 5 to 10 years, based on the age. How the age they now determine how response you pass urine, or how you position the penis now they determine how you expect it, or the quantity of fluid we take in. If picking now they drink plenty water, then bladder don't full. The capacity, the volume of urine within at the bladder now they determine the duration we they expect for wet as a whole. But to crown it all, we for primary no say the frequent urination not can necessarily relate say na gonorrhea. You get all other urogenital illness system we can provoke that. You know, your endocrine systems. If you happen for get issue with your sugar level go up, obviously for expect for wet fast. If you get any infections, if you can provoke for wet, the same thing. So the gonorrhea not can specifically be say na that relate to. Then if your bladder also full, imagine say somebody drink unusual amount of water, they sleep na net. What you expect? You obviously get for wet fast. And not only fast, it get for grab na net for wet plenty. Because a specific volume of wetting required for the bladder for contain, so that when you pass urine, you're able to meet up for pass. That's one. The second one, you say the individual make mention of if person mass dog wet. Well, some other believe you get several school of thought, because we not see the transmission or the host from animal, assuming say when dog pass urine, because many people they mass outside dog wet and not get anything for relate, but it has to deal with just belief system as a whole. And even as that, the essence, the distance at which they put your foot to what you wear, if you wear trousers or you wear any dressing you wear, how you they relate that to such infection? You know, they expect the bacterial for then at the floor, then the person gets infected. So then they just get for deal with belief system as a whole. But you know, relate. There's no science way associate with that. Yes.
The program now Well Body Talk, they come to you from the Society for Radio Democracy, 98.1 FM 0779819181. Now the number for call and make your contribution inside the program, and members here listen to we studio guest for today. We are Dr. Amadou Alosen Juana, Registrar Family Medicine, Department, University of Salon Teaching Hospital Complex. We topic on understanding and managing gonorrhea in communities. Look at the understanding. Our communities go able to raise awareness among themselves for Zika gonorrhea.
Yes, I think go from all sector, primary school, junior secondary school, the health talk required. Because through this gonorrhea self, we go able to help other infectious diseases where at a very early stage, sexual health talk can required for picking them at adolescent level, where immediately picking and get educated towards that, it able to help them, you know. Then for prevent themselves, you know, protect themselves. And for protect themselves, very important, because from the community level, you'd expect, say, most of the community comprises of youth, middle age, or ageable people. So, and this illness more they fall with young people, not ageable. You know, they expect ageable people, then can get urinary tract infection as a whole when you take more fluid for drink. But most time it has to deal with youth. And because you get for deal with youth, we could always advise, say, make you get a protective sex. And if you know, say, not true only sexual intercourse, then you for automatically they prevent yourself or protect yourself from such. Because if you protect yourself, you don't save your entire home. Because when they use a particular restroom, you automatically don't prevent that. Because anytime you go take sick outside, where you come, remember, not to for you one grain. Others, they use the same restroom way they use. You can be daddy, you can be mama, you can be uncle, you can be auntie. If you go take tot sick out, you come. That small picking go tot sick. That small bobo.
If you possible you get gonorrhea share the same bathroom, is it possible for transfer?
Well, bathroom they out of the way, now more of restroom, because vertically we talk that direct contact when through sexual, then vertically get for be upward, and upward they deal with the proximity, because bathroom now use bathroom for wash and obviously anything associated with that, but they get for deal more with the restroom, the distance, because there should be a vertical, there is a specific distance covered where you expect, say, the moment restroom being not the clean well and hygiene not the go well, then tendency they say exposure of that can do. Yeah.
Your message to listeners and viewers of Radio Democracy on the prevention, cure, and treatment of gonorrhea.
Yes, so one of the things we need for know, say, na uncomplicated infection them, like where they affect the urethra, the cervix, the rectum, the pharynx, and also the conjunctival. And because na disease way uncomplicated, where the influence for affect, we for also get an awareness, say, one, or for prepare we say for always they do checkup, you know, for man them, for woman them, just go do swab. You just go do bacterial culture. You know, they harm you, you know, cause any harm to you. Now for help you, then for make you know your status as a whole. If by adventure you don't mistake get contact with anybody, you are not okay. I prefer you go at early stage, because if you choose for go at early stage, you go able know the stage at which the disease day, then you go able prevent yourself than it spread. Because not only for you, you can then you infect the whole house. How papa go to sick, he can't give to pikin, he can't give to a wife, you know. So the entire house, you know, go tell well, you know. So your advice will say, one, let always make provision, say, the unprotected sex aspect one, the hygiene also get influence as a whole. Then for also they do routine. At least every 3 months, make provision, just routine checkup. Whether you get contact, you don't get contact, just make a routine. You can go use restroom, you know, university students. Many can complain, hey, I don't get person. It's here, I not let out person self. But also you go to sick. Hey, or something at the restroom, na the college, or they, or something at the office where I work. Yeah, na boku people they go there. All man they sit down there. No, so eventually, it's always advisable every 3 months, just do culture swab, you know, bacterial culture. You do the test as a whole. They're able to help you so that at least you go able to know which exactly they have put you.
Plenty thank you for joining me Saturday edition of the program Well Body Talk. In name na Dr. Amadou Alusen Joanna, Registrar Family Medicines Department na the University of Saloon Teaching Hospital Complex. With topic of discussion today will be the look at understanding and managing gonorrhea in communities. And in case you miss part of the program or you miss the entire program, you can go to our Facebook page and join we there and view this program as we be there live on Facebook. Plenty thank you for your joining with Dr. Amadou. May we bring you this edition of the program. Musa Kamara na my name. Plenty thank you to Fatmata Samura for making us live now.